Children's Health Fund was created to serve some of the nation's most disadvantaged and medically underserved children, starting with kids in the New York City homeless shelter system. But over the years, we've seen that barriers to accessing health care exist in other urban and many rural communities across the United States. Poverty, lack of pediatricians or medical specialists in some communities, limited access to affordable transportation to even get to doctor's appointments, and lack of health insurance, as well as language and cultural disparities, are a few of the barriers that we see all over the country. Because of the increased need for our services, we've grown to become the largest network of mobile medical, dental, and mental health services for homeless and low-income children in the United States, and we bring care directly to those who need it most. But we also recognize that children don't vote and have little influence on elected officials and policymakers. So we've worked on the front line to improve policies that impact healthcare access for kids. We speak with the people who have the power and resources to ensure the well-being of children, and we've influenced systemic changes to improve the child health safety net. But our ultimate goal is to make sure that every child in America has access to quality medical care. Unfortunately, millions of children in America are simply not getting the health care that they need. And without that health care, they suffer chronic problems and vision and hearing issues that will interfere with their ability to learn and to become productive members of our society. We need these children to grow up healthy so that they can succeed in school, they can get a job, and they can contribute to America and our future. In order for us to get there, we need to start by making sure that every child has access to a regular doctor they can depend on, and that healthy interventions are happening from early in life through young adulthood. Children's Health Fund has a history of innovation that has made our organization successful in developing and evaluating models of care that work for highly vulnerable, at-risk children. We've developed special initiatives that allow busy medical staff to tackle serious and complex health issues like obesity and asthma, while simultaneously providing them tools that help them accurately measure their successes. Then we share what works at national conferences through distribution of materials and professional publications in order to influence best practice models of care. Children's Health Fund is a pioneer in the field of electronic health records, and our work is viewed as an effective model for other institutions across the country. Children's Health Fund has worked with policymakers to improve and expand programs that impact child health care and has influenced systemic changes, including the creation and reauthorization of the Children's Health Insurance Program, or CHIP. Children's Health Fund is an effective organization because, above all else, we fill a clear and compelling need. We have 350 dedicated and talented doctors, nurses, and other pediatric providers who are across the country committed to impacting the lives of vulnerable children. We have effective programmatic and administrative systems in place and have been honored to receive a 4-star Charity Navigator rating for 4 consecutive years. From the beginning, we've insisted upon transparency and accountability in all of our programs. And finally, with the critical shortage of primary care providers and pediatricians in many communities, we train the next generation of doctors and nurses aboard our mobile clinics, and we're proud that many have gone on to lead our programs or work in communities where there's great need for such providers. Many medically underserved and disadvantaged children are cared for in our national network. This amounts to approximately 73,000 children and family members receiving nearly 250,000 healthcare visits each year. Many of the children who first come to us are behind in their immunizations. In 2010, our flagship programs, Fixed Site Community Clinic in the South Bronx, serving a very poor community, confirmed rates as high as 94% of children fully immunized by age 2, and 69% at our mobile program serving highly transient patients in homeless and domestic violence shelters. And the fixed site data that we have far exceeds national comparison data, even for commercially insured patients, where 75% are immunized. And the mobile sheltered patients are on par with housed Medicaid insured populations at 69%. Undiagnosed and undertreated asthma represents a major challenge. Our Memphis program recently implemented the Children's Health Fund's Childhood Asthma Initiative, which provides intensive training to providers on the most up-to-date practices in asthma care. In their most recent chart review, 81% of the children had well-controlled asthma. Of those who didn't, most were patients on their first visit to our program. We've documented the fact that more than 97% of children with asthma are placed on appropriate medications. One of our most difficult challenges relates to the many children who need but can't get vital subspecialty care. Our goal is to improve health equity when it comes to subspecialty care through referral management support. Using the tools and support provided by the CHF Referral Management Initiative, our South Florida Children's Health Project made close to 2,500 referrals to medical specialists in 2010, and 80% of these referrals were completed despite the severe access barriers that predominate rural and immigrant populations. We carefully manage and safeguard the generous contributions we receive from individuals, corporations, and other organizations. And for every dollar contributed, Children's Health Fund's programs leverage another $3. And finally, the thousands of stories our families share with us about how the health care they received made an impact on their life in some way represent another way of demonstrating the power and effectiveness of Children's Health Fund. An aspect of our organization that's commonly misinterpreted is that people believe that mobile clinics can't provide comprehensive, ongoing medical care. But for more than 2 decades, we've proven otherwise. Unlike some other organizations that solely advocate on behalf of children, we are actually working in the field, bringing healthcare to children where we see the problems firsthand. And this enables us to bring high-impact stories and statistics from our children and from our providers directly to policymakers in Washington. Each spring, physicians from Children's Health Fund programs across the country travel to Washington, D.C. to visit with their state representatives and discuss the challenges that their communities are facing. Additionally, we hold child health forums across the country that bring together child health advocates and healthcare providers to discuss topics related to the health status of children and their barriers to care. Children's Health Fund's major accomplishments include the development of our unique doctor's offices on wheels. We now have 50 mobile medical, dental, and mental health clinics deployed across the country. Hundreds of thousands of vulnerable children have received and are receiving comprehensive health care, and we've provided more than 2.5 million healthcare encounters to date. Our mobile clinics go to more than 280 service sites each week, including at schools, homeless shelters, housing projects, and community centers. We pioneered an electronic health record system that's now a model being used at major institutions across the U.S. And being mobile, we have the capacity to respond to disasters where the health and safety of children are endangered. This is a natural extension of our mission and enabled us to respond in Florida in 1992 after Hurricane Andrew, in New York City on 9/11, and on the Gulf Coast following Katrina, and again on the Gulf Coast after the Deepwater Horizon oil spill. And we remain now in the region with permanent programs in Mississippi and Louisiana. Some of the challenges that Children's Health Fund has faced include translating the short-term solution of our mobile medical clinics into a legitimate long-term solution for the challenge of getting primary health care to people. When we originally started the Children's Health Fund, we thought the problem of healthcare access for poor and homeless kids could be solved in 10, maybe 15 years. But the economy and politics and more barriers to care have made it necessary for us to continue to enhance the depth and breadth of services we provide. Unbelievably, more families are living in poverty today than when we started in 1987. It's very difficult to imagine that so many people who live in this great country have to actually choose between buying food for their family or taking their child to a doctor. And without early healthcare intervention when it's needed, there could be lifelong consequences. We just need to keep these issues on the front page and in the minds of policymakers and the public. With additional resources, Children's Health Fund will provide enhanced and sustained services, including increasing the number of children and families we serve. We'll establish additional projects and build new mobile clinics to replace both the older clinics and enhance projects' capabilities with multiple clinics. We'll seek and promote breakthroughs, including replicating best practices and models of care through the integration of oral health care, mental and behavioral health care, early childhood services, and nutritional services. And we need to expand our efforts to help control the national epidemics of childhood asthma and childhood obesity. We'll redouble our work on making sure that children get the specialty care they need and disseminate models of care and associated health education materials to the broader community. And finally, we want to be a voice on Capitol Hill for vulnerable children with the goal of ensuring access to health care for all children. We won't rest until every child in America has access to the health care they need. The key information here is that of the 74 million children in America under the age of 18, some 8 million still do not have health insurance coverage. But most shockingly, another 10 or 12 million children may have coverage, but they have other barriers keeping them from getting to the doctor when they need to go. Those barriers may include living in communities with severe doctor shortages or lack of public transportation to allow families to get their kids to the doctor's office or clinic. So for the Children's Health Fund, our first responsibility and our first goal is to make sure we have an active, growing healthcare network for vulnerable children. That means replacing some of the aging mobile units, some of which are 20 years old or more, and expanding the number of mobile clinics in our fleet, making sure that we have comprehensive medical care as well as behavioral health and oral health services available for children. So improving and expanding direct health services is goal number one. Goal number two has to do with our work primarily in Washington, D.C. Children's Health Fund has been a strong and I think powerful advocate for vulnerable children. We go directly to the policymakers and elected officials and speak out on behalf of those children and families who otherwise have no voice. If we can improve our capacity to provide clinical services and strengthen our advocacy efforts, we'll have a successful decade looking forward.